Hey everyone, today's focus will be on Crohn's disease. This 3-minute video will be an exploration of the symptoms, signs, causes, treatment, and management of the condition. So you're probably thinking, what is Crohn's disease? Well, Crohn's disease is a chronic inflammatory bowel disease that is characterized by an excessive immune response to an environmental trigger. It is also important to note that the condition is an autoimmune related disorder. And what this means is that it's a condition in which your immune system is mistaking your healthy host cells for disease-causing microorganisms known as pathogens. This inability to differentiate between an invader and self results in your body's T helper cells, the soldiers of the body, mistakenly attacking your healthy cells. And this is why Crohn's disease causes transmural inflammation, ulceration, and tissue destruction anywhere along the epithelial lining of the digestive tract, from the mouth to the anus. Although the exact cause is not yet understood, current thinking is that the unregulated inflammation of Crohn's disease is caused by a combination of environmental factors like smoking, stress, and high saturated fat diets, and genetic predisposition factors like race and family history, as all of these factors have been shown to increase a person's risk of developing the disease. Your doctor will help you monitor your condition by ordering several diagnostic tests. Some common tests used are a CBC test to check for iron deficiency, a CMP test to test for electrolyte imbalances, colonoscopies to inspect for ulceration and tissue damage in your large intestine, and a blood and stool test to examine for vitamin and mineral deficiencies. It is important to note that people suffering from Crohn's disease will often experience alternating periods of remission where they have little to no symptoms, and relapse where their symptoms flare up. During a period of relapse, it is expected that the patient will experience the following signs and symptoms: fever and fatigue, weight loss due to malnutrition or a loss of appetite, abdominal pain and tenderness in the lower right abdominal region, diarrhea, and blood and stool if there's an ulceration in the large intestine. Although these signs and symptoms may be scary, it is important to note that there are disease management processes and treatments that can be used to alleviate symptoms and subsequently improve quality of life. When considering disease management, it is important to note that Crohn's disease is a chronic condition and therefore will be present over the course of the patient's life. However, patients and physicians can work together to manage and alleviate some of the symptoms of the disease to increase the patient's overall quality of life. Some of the methods that have been shown to alleviate symptoms and improve quality of life in patients include quitting smoking immediately, implementing a dairy-free diet, avoiding raw nuts and vegetables, avoiding foods with high saturated fats like butter, taking iron, calcium, and vitamin D supplements to combat malnutrition, drinking plenty of water to stay hydrated, removing stressful factors, and drinking green tea, as it's been shown to reduce inflammation. Medical treatments have also been shown to improve quality of life, with immunosuppressants, corticosteroids, and anti-inflammatory drugs most commonly prescribed. For more information on Crohn's disease, check the links below or consult your doctor.